OK， 全屏哪里是可以全屏？
徐主任在那个放映那里，幻灯片放映有一个全屏，
上面是下边，上面是下
上面有幻灯片放映，在后面右边幻灯就是切你刚才那个地方。看开始那个地方，第2个插入第3个设计，第四在正好的右边，在一点点。
幻灯片从头开始，对，抱歉。
对。
OK. My topic is because I just finished my operation. I'm now in my OP room. My topic is some changed. My topic is the history and the technical details of UBE BESS ULBD. I'm Dao Xu from China. My topic includes 3 parts. First, the history of the ULBD. Second, the lumbar ULBD case by UBE. Third, the thoracic ULBD case by UBE. ULBD means unilateral laminotomy for bilateral decompression. The indication for ULBD include the central spinal stenosis and the both side lateral recess stenosis. Sometimes include foraminal stenosis. This video is the ULBD. First, let's talk about the birth of the ULBD. In 1995, American doctor Polity came out with the idea of unilateral laminotomy for bilateral ligamentectomy to treat 2 cases of lumbar stenosis caused by ligamental fluid hypertrophy. The author believes this can preserve parts of vertebral arch and the spinal process. Also can preserve supraspinous and interspinous ligament, so it can reduce the spine instability caused by wide laminectomy. The German doctor Spenziger formally described the technical details of ULBD under microscope in 1997. First, he do the cadaver study. Then he also do the clinical study. He first formally present the technical details of ULBD. From the figure, we can see the ipsilateral nerve root and the contralateral nerve root. We can see it clearly. ULBD based the concept of reducing post-operative instability caused by wide decompression surgery as much as possible. Let's see the first case. My first case is a 70 years old female. Both leg weakness and numbness, neurogenic claudication. We can see the patient have a severe lumbar stenosis and spondylolisthesis. It is fixed, no instability, grade 1, and cauda equina syndrome. There are many treatment options, include belief, TLIF. We choose the UBE ULBD. My option is UBE ULBD. First is the beginning comfort. It is the spinal process. The bottom is artificial. This is the beginning camp. Then we do laminectomy with burn autotome and also calcium pump. This is ligament flavor, dark. Maybe it is necrosis or ligament flavor. Then we separate adhesion between the ligament flavor and the dural sac. Separate the adhesion between the ligament flavor and the dural sac. No dural here in this case. Then it is the contralateral exiting nerve road. Contralateral exiting nerve road, and the contralateral traversing nerve road. It is the middle part of pedicle. This is the ipsilateral traversing nerve road. So from we decompressed 3 nerve road from ULBD. This is the preoperative CT scan and postoperative CT and MR. Pre-operation, post-operation. Second case is the right leg pain. Right lateral recess stenosis combined with foraminal stenosis, compressed L3 and L4, 2 nerve road. We choose contralateral over the top decompression. Contralateral decompression over the top. We decompressed both exiting nerve road and the traversing nerve road. This is it is exiting nerve road. By the UBE base contralateral decompression, we decompressed both exiting nerve road and traversing nerve road, and preserved articular. It is the traversing nerve road. And the middle part of pedicle, traversing nerve road. Also the ipsilateral nerve road be decompressed. Post-operation, we do the over the top decompression, decompressed both exiting and traversing nerve road, and preserved articular. Next, let's see the thoracic ULBD case. Sorry, it is a 65 years male, a complaint numbness and weakness of left leg. The diagnosis is thoracic stenosis and collateral stenosis. The stenosis because of the ossification of ligament flavor. We do the thoracic ULBD where the UBE base. It is calcified ligament flavor. Calcified ligament flavor. First, we find central folding from the disc SP base. Central folding. So then, with a diamond burr, we do the contralateral depression along the deep layer of ligament flavor. Contralateral depression. Pre-operation and post-operation. The patient can walk by himself. Before operation, the patient couldn't walk by himself. So UBE base is an endoscopy assisted open surgery. Thank you.